Good evening, everyone. It's a beautiful Sunday to meet all of you here. And to the fans of Manchester United, congratulations. As you know, today's meeting is a little bit different from what we've been doing before, because today's topic is on professional, professional and career development, specifically how to impress your potential employer. And for today's webinar, we'll be tackling two major issues. And the two major issues will be one on career development and how to write a winning CV. And then the other major issue that we'll be tackling will be how to prepare for a job interview. And so at this juncture, I would like to call upon Margaret Wairema. Now, when you have your resume, it's ready, or you have your CV, it's ready, you've been called up for an interview. How do you prepare for a job interview to make an impression? So Maggie will be taking us through that. Karibu sana, Margaret. Yes, loud and clear now. Karibu sana.
Good. So my name is Margaret Wairema Maina. I was invited through RNC. I'm the convener. As I try to get my slide ready, if we can quickly go through a simple presentation of what RNC is. If you allow me, I'll share my screen.
Yes, please.
Simply allow me to share my screen.
Allowed.
Thank you. So we can start with a brief introduction of RNC to today's attendees. RNC is an online-based network for Kenyan registered nurses. We are aiming to gather around nurses who'd like to connect with other nurses of similar interest. And currently we're just based on Instagram, but we are looking to optimize to other platforms. And for those who don't know, we currently share job opportunity, professional development platforms like today's platform. We also every now and then highlight the plight of nurses. We discuss current affairs in the field, and once in a while we go hang out. Our objective is to basically bring together nurses of like minds to improve our social life experiences, go out there, hang out, have fun, make friends, and also foster a culture of self-care, because we have also seen what our work environment has done to fellow nurses. We have seen people sink into mental health issues and such issues. We could also like to bring around mentorship programs. So people who are willing to be mentors or be mentored can reach out. And the future RNC, we hope to optimize to a web-based platform in a community-based membership. Then we can do maybe quarterly meetups and other collaborations. So let me try and see slideshow. Yeah, and now to the business of the day.
Maggie, I'm not sure if it's from the end, but I'm not able to see the presentation.
You can't see it?
Yes, yes.
You can see it.
Maybe you reload it again.
Okay. And now, can you see?
Now you are sharing. Very nice, very nice.
Very nice, very nice. So let's go directly.
Or if you just put it on slideshow, then it'll be good.
The business of the day, which is getting ready for an agency interview. You've done your application, have a catchy CV, it's impressive, made the agency happy, and now you have decided to give you an interview. How do you get ready for you? I decided to
Can't hear you, please.
Hi, Maggie.
Interrupt
Once again, sorry for interruption.
Go ahead.
You able to hear me now?
Yes, we can hear you now.
Yes, you're back.
Okay. Thanks. So as I was saying, you need to prepare about your job station. Maybe you applied for a job in med-surg, maternity, or psychiatry. You should be able to know your job station like the back of your palm. You need to be well aware of their most-in conditions and their management. This will also help the agency or the one who is hiring you compare to see if you are fit, if you're a fit for their position. You also need to have equipment knowledge, and this equipment knowledge could span from equipment you have in the units that you have handled and those that you have not handled. Because in our setting, you see sometimes some equipment is left to a few people to handle because of maybe shortage or not the knowledge gap. So maybe you should be able to highlight, you're able to maybe use a pulse oximeter, glucometer, and all that. Don't undermine even using a thermometer. You should be able to bring it out well during your interview. You should also be well aware of the procedures done. And by procedures done, in our country, and especially in most of our job stations, we are very used to shortcuts. We also use a lot of improvisation. So when you're preparing for an agency interview, kindly know what is the ideal. Don't go there mentioning your shortcuts, please. You should also know what your work hours are. Your potential employer is looking to see if you're able to handle maybe their shift. If your shift is maybe 12 hours and maybe theirs is 8 or the other way around, they're able to gauge if you're able to go out there and perform without having much pressure. Know your nurse-patient ratios well. This will also help your future employer to see if you're able to handle what they have in their floors. Know your unit schedule and shift setups. Know your reporting times. How many night shifts you're able to do. How are your shifts? Is it evening off, morning off, or night and day? Should be able to bring that out clearly. And sometimes, and more relevantly, is sometimes the unit design and their rationales. There are those people who have applied jobs in OR. They can ask you questions about design and materials used to maybe make the floor of the theater, the terrain of the theater, and such questions may arise. Yes, and now the other point of preparation is your content. That is about your CV, resume, and history, working in histories. Recently, we see most people pay people to do their CV. Please, even if someone did your CV, before the scheduled day of the interview, go through your CV, know what is in the script. Stick to what you said, peruse through your CV, and don't mix up dates. Don't be this guy at the interview when your agency is asking you questions and you're like acting shocked as if, hey, is this me or not? So please review your CV prior the interview. The other thing you may need to prepare your environment. I've seen people show up for agency interviews through a phone, and maybe the schedule, you have been given like a month to prepare for your interview. Kindly, it's professional to have a laptop and a good connection. You can try your earphones. Don't be like me. I'm trying to play with my earphones right now. So even if you don't have a laptop, get a friend who has a laptop, book it. It's maybe the interview can be like 1 hour or 30 minutes. So it's such a short while. Someone is able to issue you their laptop. Have a good internet connection, obviously. Not kila saa kwa interview are just like, sorry, don't go well. Ambience, it's about the noise levels and distraction levels. If possible, you can even go to a meeting room or book a meeting room or be at home in a locked room and make sure the people around you are well prepared that on a particular day at 2 p.m. I have an important meeting, so kindly msisumbue. Then have good lighting for the interview. If possible, schedule the interview during the day. Some agencies will give you the option of saying when you're available. Schedule the meeting during the day. About software, most often than not, they'll use Zoom. Some will use Skype, and in other occurrences, they can use WhatsApp. So kindly make sure before, like the day before the interview, you have installed the applications and you have actually done a trial on how to use software. Dress code. Don't show up in pajamas, kindly. Dress officially, like you would going to a physical interview. Most of them will be on video, so you can have an official top. An official top. If you have it in a short, but at least have a
We can't hear.
Now, can you hear me? Someone tell me if you can hear me.
Yes, you are back now.
Okay. So about personal presentation, I was saying that you should get adequate rest, because when you're well rested, people can actually see you're rested. Also, schedule your interview during the days off or take a day off. Being confident and honest, as Jerusha said, honesty goes a long way. Because if you lie now, you might need another lie to cover your other lie. So it's easier to be honest. And even if you feel like maybe what you're telling the agency or the interviewers is to their standard, they would also understand that our level of practice may not be as high it is up there in terms of maybe equipment, machines, and all that. So be honest. Take your biological breaks. Before joining the meeting, go to the washroom, empty your bladder, take some water and all that. It goes a long way. Yeah. Prepare adequately for speech, be coherent and fluent. That is obvious. Make sure you're comfortable, get a nice seat. You can even put a cushion underneath. Yes. As the note says, prepare as if you're going for a physical interview. Other pointers, you could also practice on the common nursing code of practice, ethical practices. Most of these things are universal in nursing care. Don't be left out in emerging issues during your interview. Like those who are scheduled for their interviews this week, you understand there's earthquakes in Turkey, and we could ask you a scenario question, like maybe you're in an earthquake and you have a patient, what would you do? So also be up to date with the emerging issues. Some countries will ask you questions about the LGBT community, equality, such things may come up in your interviews. And I'll also recommend that you go on YouTube and learn about commonly asked questions in interviews. Most of these questions will keep repeating themselves, like the rights of medication, like, such things. Just be up to date. Don't look clueless. I also saw somewhere, especially on the common asked questions, in some countries like the UK, you'll find they have additional rights of medication. You can try and read. We live in a world of information. So just a few highlights about shortcuts, improvisation, SOPs, and ideal procedures. Most of us who have worked in maternity know how we do this. Please, during your interview, when you're asked about artificial rupture of membranes, don't mention the syringe thing. So really deal and improve your knowledge on SOPs and ideal procedures, which most of them are in the Nursing Council procedure manuals. Don't go there mentioning your shortcuts kindly. And I think that's it from my end. I didn't want to make it so long. And there's so much to learn when you're prepping for interviews. You can go out there and read about how to get ready for calls. Some agencies will also give you a call interview. So please go and read further. This is just a highlight of maybe what to expect. Yeah, and I hope I've taught you something today, and that we'll share more in the comment section and the question section. Thank you guys for listening.
All right. So if we don't have any other question, then we are going to take a call to action. And for our call to action, we'll begin with Maggie, then Jerusha, and then Humphrey. So Margaret, welcome. Give us a call to action.
Hi once again. My call to action would be, keep doing what you're doing, keep at it. Don't let those small issues stop you from achieving your goals. There'll always be a way out, especially on that policy. I also wanted to encourage people, if you have started the process, don't stop, keep going. And kindly remember to follow our page on Instagram, Registered Nurses Connect. Yeah, tell a friend to tell a friend, and see you soon.
Thank you very much, Margaret. Jerusha.
Thank you. My call to action will be persistence and perseverance. It's a long process, it's a torturous process, and it's a painful process. But at the end of it all, the fruits are sweeter. So I would recommend that you be persistent and be perseverance in your journey, especially if you're planning to come and work as an RN in the US. I wish you all the best, and we are ready and able to review any CVs that you send to us so that we can assist you customize them to your liking. Thank you.
Thank you very much. And then Humphrey.
Yeah, thank you very much once again, everyone, and our speakers for honoring the invitation and also giving us very enlightening presentations. Myself, I had something to learn from the presentations that have been made. And to encourage my fellow colleagues, professional colleagues, let us safeguard the profession with a lot of zeal. And as you safeguard the profession, also make sure that you take advantage of the available opportunities. No one should dictate to you how you are going to benefit from the available opportunities. Just grab them and have a good life, because this opportunity has presented itself. A few years ago, such opportunities were not available, or the avenues that are there right now were not available. And it was difficult to even those who are willing. So since they are there today, let us utilize them. Lastly, I would like to say that at Passcode, we do help people with preparations for interviews and also with the CVs and resumes. Do not hesitate to reach us whenever you need any assistance. And apart from that, if you are struggling with anything in the process of preparing to move out of the country, we are there to assist you, and this is what we do. So we do have a vast, wide experience in terms of these issues of moving out. So have a nice evening, and I wish you all the best in your profession. Thank you very much.
Thank you very much, Sir Humphrey. Just to let us know that this meeting is being recorded, and a link for its recording will be shared later during the week. My call to action as we come to the close of the meeting is that help is here. Do not sit down to yourself whenever you need help, whether is it CV or interview preparation or immigration. Please do not hesitate to reach out to Passcode. The contacts are in the group. Take your time, copy down those contacts and contact them. The earlier, the better, because all actions and your future is all in your hand.